Physiologic studies are very important in coronaries, certainly in intermediate lesions, where we want to know if the lesion is severe or not. And second point to use physiologic studies is also to multi-vessel, to know which lesion is the culprit lesion and to treat it.
So it's extremely important to use physiology because the angiographic assessment of a coronary lesion is extremely inaccurate, especially when you deal with intermediate lesions. And also physiology can help you now to assess the focality of the lesion. This is also very important as compared to diffuse disease. If you have a very diffuse drop in pressure when you assess the lesion, we know that that kind of lesion will respond less well actually to coronary stenting as compared to a very focal lesion with a very important drop of pressure at the level of the lesion.
As any operator, I use physiology in intermediate coronary stenosis, and this has a class 1A recommendation for the ACIST guidelines. Moreover, we use physiology in multi-vessel disease in order to simplify the procedure, but more importantly now we use physiology also after PCI when we have a positivity at physiology before PCI.
Las indicaciones están claramente establecidas. Es el tomar decisiones sobre placas, lesiones o obstrucciones coronarias que ya las llamamos genéricamente moderadas, es decir, en las que no tenemos la certeza de que producen isquemia y no tenemos la certeza de que haya que revascularizar solamente con la estimación visual.
By using Navvus, it is very user-friendly and for sure it is time-saving because it is much more easier to do FFR and DPR measurement with Navvus than with wire-based technologies. We made a comparison between the both methods, so it's absolutely identical. As a result, in mid-range lesions, which are usually the lesions which we have to assess.
The advantage of using the Navvus II system is that it's a very easy system to use because you have over a wire system. So you can use your wire in cases where there are long calcified lesions or important tortuosity. The second advantage is that we see in experience that there is less drift than with other measurement systems.
The microcatheter can actually be loaded in any kind of workhorse wire, and if you use a regular pressure wire, it can be sometimes extremely cumbersome to reach the distal part of the vessel because of tortuosity, because you can damage during all the manipulation the pressure wire, and like that it's sometimes difficult to reuse this wire for assessing the physiological significance of another lesion in another vessel, or if you want to, for example, to assess the results after stenting, you want to do a post-stenting physiological assessment, and that's where the microcatheter is extremely easy to use in a daily practice.
The Navvus MicroCatheter helped me applying physiology in every procedure. Indeed, it is well known that lesion with non-significant FFR can be safely deferred. Otherwise, when we have a significant lesion, we can perform a PCI and then we can reassess easily physiology after PCI using the same microcatheter, the Navvus II. The Navvus II MicroCatheter has the advantage of enabling the operator to work with a standard workhorse wire. And as any other intervention, this could be an advantage in complex anatomies, But more importantly, this can allow the operator to have always the rapid access to the vessel. And this could help the operators in performing all the pullback maneuver the operator wants to perform.
Nosotros utilizamos muy frecuentemente el catéter Navvus. Te proporciona una facilidad del estudio funcional por encima de la media, porque puedes utilizar la guía de trabajo intracoronaria que uno elija y por lo tanto llegar al vaso distal que vas a explorar es mucho más fácil. Además te permite estudiar en el mismo procedimiento varios vasos o distintos, simplemente cambiando la guía de sitio y haciendo el estudio, repitiendo el estudio con el mismo catéter. Y tiene otra ventaja también que no es despreciable, es cuando tienes cierta sospecha de que ha habido drift de presión o que ha habido algún tipo de decalaje de la ecualización, sin retirar la guía se puede hacer pullback y retirar y comprobar que persiste la ecualización correctamente ante dudas que pueden surgir en la interpretación de los resultados. Es un catéter excepcional, cómodo, muy fácil de usar, navega muy bien y están contrastadas sus mediciones. Es fabuloso.
The method is robust for the daily usage. The learning curve is very steep, so practically all our operators were trained very fast and became familiar with the technologies.